Okay, now an alliance of civil society and academic organizations is calling on the finance minister to implement the sugar tax immediately. Heala has expressed disappointment that the increases that were agreed to in 2018 will only be implemented in 2023. Heala says the decision to postpone the health promotion levy was the result of the sugar industry's interference and lobbying. Well, let's discuss this further now, joined by Heala's program head, Lawrence Mbalati. Mr. Mbalati, good afternoon. Welcome to Today on eNCA. We're talking to you just 2 days before Mr. Enoch Gondongwana tables the medium-term budget in Parliament on Wednesday. As Finance Minister, I guess your timing is perfect in that. What are you exactly, as Heala, calling for when it comes to the health promotion levy, popularly known as the sugar tax?
Thank you and good afternoon to the viewers. We have been concerned that the sugar tax or the health promotion levy, since it was implemented, it has never really had any form of increase, which easily gets it eroded in terms of what it's intended to achieve. So you will know that things like alcohol and tobacco will get inflation-based increases. We have not gotten that on the sugar tax. And I think what we're calling the minister to do is to prioritize the public health of people who live in South Africa and ensure that the levy is strengthened and is increased significantly to catch up with all these many years that we have not seen increase on. And we are also disappointed that the sugar industry lobbied, had an interministerial meeting with Department of Agriculture, Department of Trade and Industry and Treasury, without any other stakeholders, to push for reversal of the increase that was supposed to be implemented in February 2022.
Yeah, and are you also making calls for the amount of the tax to be increased?
Yes, so there are mainly three things that we are calling for in terms of this tax, because research is showing, the slowing down and reduction in the sugar consumption, which is great because in the long term, we know that will contribute significantly in reducing obesity and its related health illnesses. So we're calling for the tax to be increased from 11% to 20%. We are also calling for the tax to be expanded, an expansion to include things like fruit juices, not only cold drinks, because we know that some fruit juices have a higher sugar content more than even cold drinks. And we are also calling for the minister to also consider readjusting the volumes in terms of the quantity of sugar per volume, because from 400 milligrams to 200 milligrams as part of strengthening this tax, as it has been shown to be working in reducing or curbing the overconsumption of sugar.
Yeah, your clarion call, I understand, Mr. Mbalati, is that a healthy economy needs a healthy population, and we know the kinds of negative aspects of too much sugar consumption when it comes to non-communicable diseases in the country and the cost burden as a result of that on the economy.
Precisely, and I think that's the most important and a profound comment, because the cost out of the burden of non-communicable diseases is too high. We know there's data that is showing us that it does cost the national health budget about 5 billion, 10 billion, I mean. Again, we know that, the high cost of immobility, and death, it's as a result of the non-communicable disease. All combined, the non-communicable disease are the leading cause of death in the country. And this, we have not included the burden to the households in terms of the cost of transport to clinics for people with hypertension or with diabetes. So we're just talking about the cost to the health system, not including the costs that are borne by citizens in the country. So it's important that when we have important preventative measures, we have seen since the tax was introduced a reformulation, to a much more healthier option. So we have to fix this food system, because it's difficult even these days, even if you go to a supermarket, to buy something that it's not high on sugar or high on fat or high on salt. So it's important that we can actually start to work on using policies and regulations that can, kind of like force the food producers to reformulate and to create healthier food options.
Yeah, but I mean, the sugar industry is a very formidable force. I mean, they have powerful lobbying capacity, if we can say that, from what we've gathered. How confident are you that the minister will listen to what seems to me very well thought out advice in terms of how to manage the sugar tax?
And that's a very important point, because even the minister, reversing the decision, it's not only disappointing, but it also shows the hand, what we call industry interference in government, formulating health policies that respond to the needs of our health. It's very problematic when you have, a treasurer or a ministry that, yield to few individual and private interests at the expense of the majority of people's health. So that's number one. But what we're thinking we will do this time, which is slightly different, is we are monitoring the relationship that the state is having with the sugar industry and the private sector in general. So we have put a public access to information application with Treasury to disclose the private meetings that they've had, what informed the decision. And also we are going to Parliament on Wednesday, 26th of March, to actually tell our constituency to say, we are actually, the trust is eroding of public in terms of if government, and in this particular treasury, can be trusted, in taking initiatives that protect our health. So we're going to hand over a memorandum through a demonstration or a march on the 26th of March. But we are going to have a package of intervention to put more pressure on Treasury, but also to hold the industry accountable in having private meetings and lobbying government, because we have opened our eyes and we've put our ears on the ground.
Okay, finally, Mr. Mbalati, very briefly, the sugar industry turns around and says, you tax us too much. If you increase the tax, we're going to lose jobs. How do you respond to that?
I think that is the biggest problem, and actually it's the same handbook that tobacco uses, that alcohol uses, that always when there is a public health policy and intervention, the issue of job losses get thrown out. The biggest problem with this issue of the job loss is that numbers get thrown out. And it's difficult at the moment to show evidence that, the sugar industry, is struggling because of this tax. Because the industry has been struggling for all these years, even before the tax was implemented, including, cheap imports from Eswatini and countries like Brazil, local industries like these beverages that now are using small-scale farmers to argue the issue of job losses. Have been the one who have been buying sugar outside the country, for example, for so many years. So I think the industry cannot, want to sustain itself or its profit through, people consuming excess sugar as a way of them remaining, afloat and relevant.
Thank you very much. That's Lawrence Mbalati. He's, of course, from the Healthy Living Alliance, Heala, on their plea and call from government ahead of Wednesday's budget to increase the sugar tax to 20%. And we'll have to wait and see what Mr. Enoch Odongwana will say to that. They're also disappointed that the implementation of what was agreed in 2018 about the sugar tax has been postponed to 2023. They're calling for its immediate implementation.